Hi, my name is Dr. Megan West from West Niagara Chiropractic and Wellness Center. Today I'd like to talk to you about scoliosis. Now there are two types of scoliosis. First one is idiopathic scoliosis, which basically means unknown origin, unknown cause. And number two is anatomical scoliosis, which is usually from a trauma or a deformity within the spine. Scoliosis can occur through a couple of different reasons. There could be a trauma to the spine, either triggered during a birth injury or possibly a fall off of a bicycle. It can also occur if there's a deformity in the spine, so if the person was born with a congenital anomaly. Now, a chiropractic approach to treating this particular patient would be to mobilize or adjust the whole spine. We would pretty much adjust her right from her neck all the way down to her hips in order to keep every joint moving. And in doing that would help prevent progression of the curvature. In this particular x-ray, this is a female, and this is an example of an idiopathic scoliosis. So it was unknown origin or unknown reason why it's developed. As you can see in her upper thoracic spine, which is this area here, it curves to the left and into her cervical spine, which is up in here. There's also a compensating curve down here. This is her lumbar spine. A chiropractic approach to treating this patient would be to adjust and manipulate the whole spine, because what you're doing at that point is you're mobilizing each and every joint to help keep those joints moving. We would also look at particular exercises for this patient, such as swimming, something where she would be using her shoulders to help work these ribs that are up here. We can treat patients with scoliosis of all ages, but if we can pick them up early, even younger than the age of 8, then we can monitor them, we can see if it's progressing or not, we can co-treat with a medical doctor if we have to, make any necessary referrals. But a few things that we pick up as chiropractors, which is sometimes the first line of defense, I'm going to show you a few things that we can see on Colin here. We would check out his arches to see if he's got flat feet. We can also look at his knees to see if they're bowing or if they're knock-kneed at all. We can measure his hip heights to see if they're level or not. Maybe he has a shorter leg. We can also run our hands down his spine and we feel for muscular imbalance as well as rib humping or uneven shoulder heights, which also gives us an idea there's a scoliosis going on. And we look at his ear heights. So a good overall posture check is the best screening for scoliosis. If you have scoliosis or you suspect your child has scoliosis and you'd like them assessed by a chiropractor, call us at West Niagara Chiropractic and Wellness Center.